Eyes, tips, health. Part 1. The biological blueprint, how sugar blinds the eye. The eye is often called the window to the soul, but in clinical terms, it is the window to your vascular health. Your retina, the light-sensitive tissue at the back of the eye, is home to the smallest, most delicate blood vessels in the human body. These microvessels are the first casualties in the war against diabetes. When blood sugar remains elevated, it triggers a process known as glucose. In this segment, we explore the basement membrane thickening. Imagine the tiny vessels in your eyes as delicate glass pipes. High glucose acts like high-pressure steam, causing the walls of these pipes to weaken and bulge, forming microaneurysms. As the walls thin, they begin to leak fluid and blood into the retina, a condition known as macular edema. According to the American Academy of Ophthalmology, this is the leading cause of vision loss in people with diabetes. We dive deep into the role of VEGF, vascular endothelial growth factor, a protein your eye produces in attempt to grow new vessels to replace the damaged ones. However, these new vessels are junk vessels, fragile, leaky, and prone to causing retinal detachment. Part 2. The silent leak, recognizing non-classical eye symptoms. The tragedy of diabetic eye disease is its silence. Much like the silent heart attack discussed in cardiac health, diabetic retinopathy often presents zero pain. Because there are no pain receptors in the retina, your eyes can be actively bleeding internally without you feeling a single itch or ache. We break down the visual warning signs. Instead of pain, look for floaters, tiny spots, or dark strings floating in your field of vision. These are not just annoying. They are often actual drops of blood suspended in the vitreous gel of your eye. We explain fluctuating vision. If your glasses prescription seems to change from morning to evening, it is likely not your eyes changing shape, but your lens swelling due to high sugar levels. We cite Mayo Clinic, explaining why sudden blurriness is often mistaken for simple tiredness, when it is actually a sign of retinal swelling. We teach the viewer the Amsler grid test. If straight lines like door frames or window blinds appear wavy, your central vision is in immediate danger. Part 3. The nutritional shield, foods that protect the retina. To save your sight, you must eat from microvascular strength. We move beyond general healthy eating and focus on ocular bioavailability. We introduce the lutein and zeaxanthine protocol. These are the internal sunglasses for your eyes. Carotenoids that deposit directly into the macula to filter out harmful blue light and neutralize oxidative stress caused by glucose. We explore the role of anthocyanins, found in dark berries like bilberries and blueberries, which have been shown to improve night vision and strengthen capillary walls. We explain the vitamin C glutathione link. The fluid inside your eye has a concentration of vitamin C nearly 20 times higher than your blood. When diabetes depletes this, your lens becomes cloudy, leading to diabetic cataracts. We provide a vascular vision salad blueprint, combining spinach lutein, walnuts omega-3 sal for tear film, and bell peppers vitamin C. We emphasize that managing eye health is 80% what happens in the kitchen, not the pharmacy. Part 4. The kinetic oxygenation exercise for ocular pressure. Exercise is the best way to vacuum the sugar out of your ocular fluid. In this section, we explain the ocular perfusion pressure. When you engage in steady-state cardio, you aren't just helping your heart. You are forcing oxygenated blood into the tiny, starved capillaries of the eye. We discuss the sugar siphon effect. Science shows that a brisk 20-minute walk lowers intraocular pressure by improving the drainage of fluid within the eye. However, we also issue a diabetic safety warning for those with advanced retinopathy. Heavy weightlifting or straining the Valsalva maneuver can actually cause fragile eye vessels to burst. We recommend a lume-packed consistency model. We explain how muscles acting as glucose sinks prevents the post-meal spikes that cause the lens to swell and blur. We cite the American Diabetes Association (ADA) guidelines on how regular movement can reduce the risk of progressing to proliferative retinopathy by over 30%. Part 5. The longevity exam, advanced testing, and prevention. The final pillar is the modern diagnostic battery. A simple reading test at the DMV is not an eye exam. If you are diabetic, you need a dilated retinal exam at least once a year. We explain the OCT scan, optical coherence tomography, a non-invasive imaging test that takes cross-section pictures of your retina, allowing doctors to see under the surface for swelling that is invisible to the naked eye. We discuss the anti-VEGF revolution. We explore how modern medicine can now dry up leaking vessels using specialized injections, effectively stopping blindness in its tracks. We conclude with a message of systemic unity. Your eyes are the only place in the body where a doctor can see your blood vessels live without surgery. If your eye doctor sees damage, your heart and kidneys are likely suffering too. By saving your eyes, you are essentially saving your life. We provide a clinical eye checklist to take to your ophthalmologist, including questions about macular thickness and retinal ischemia.